Hey guys, it's Aaron.
I'm Theo.
I'm Amy.
And today we'll be looking at the effects of the 12-week eccentric and isometric training plan on the gastrocnemius muscle and the Achilles tendinopathy using an ultrasound shear wave elastography. So the purpose of this study was to evaluate the effects on a 12-week of eccentric and combined isometric and eccentric contractions on the elastic properties of the medial and lateral gastrocnemius muscles in patients with Achilles tendinopathy. This study used shear wave elastography, an imaging device, to measure changes in muscle stiffness, aiming to clarify whether these common therapeutic exercises influence muscle tendon systems' mechanical properties. The three things that the purpose of this research looked at was to determine if such exercises improve the elasticity of symptomatic limbs, to investigate potential cross-education effects on asymptomatic limbs, and to provide evidence-based insights into the effectiveness of the interventions of managing Achilles tendinopathy. So some important definitions that we have listed here. Shear wave elastography. So shear wave elastography shows the quantitative measurements of tissue elasticity by sending ultrasound waves through the muscle tissue. The waves are then recorded and converted into quantitative data by speed. Shear waves travel more slowly in softer, more elastic tissues, and faster in more stiffer tissues. Isometric contractions are a muscular contraction where the muscle does not lengthen. For an example, a wall sit is an example of this contraction. Eccentric is a muscle contraction where the muscle lengthens, such as lowering portion of a pull-up or a squat. The gastrocnemius is a muscle group found in the lower extremity of the leg. The gastrocnemius forms with the soleus to create the Achilles tendon, which inserts on the posterior and plantar surfaces of the calcaneus. The Achilles tendon is the strongest tendon in the human body. It is also responsible for Achilles tendinopathy, which is an overuse injury which occurs when small tears form in the Achilles tendon. This injury is common in runners and those who play sports that involve jumping, such as basketball or volleyball. So the purpose of this study was to evaluate the effects of long-term calf muscle elasticity using eccentric and isometric exercises at 4 and 12 weeks to treat Achilles tendinopathy. The researchers aimed to address the lack of clarity there is on effectiveness of eccentric and eccentric plus isometric exercises in managing Achilles tendinopathy. Specifically, they sought to understand how these exercises affect the elastic properties of the gastrocnemius muscle, and these play an important role in the calf muscle Achilles tendon complex. The hypothesis of the study is that combining both isometric and eccentric exercises will reduce the effects of Achilles tendinopathy compared to just whenever doing eccentric exercise.
Go.
Recently, shear wave elastography has been used as a real-time diagnostic imaging technique which allows for identification of tight or injured muscles. There's been plenty of research on the rehabilitation of the Achilles tendon itself, but not the whole muscle tendon unit of the gastrocnemius and Achilles tendon, which this study examines. Those who performed this study looked into various articles on similar injuries. The first study, isometric exercise induces analgesia and reduces inhibition in patellar tendinopathy, looked into isotonic and isometric exercises and whether those exercises could reduce pain in the patellar tendon. This study looked at 6 male volleyball athletes with patellar tendon pain. It was found that isometric exercises reduced patellar tendon pain for at least 45 minutes post-exercise. It was found that isotonic exercise reduced patellar tendon pain, but it wasn't sustained. It also found that there was a greater percentage of motor unit activation while doing isometric exercises when compared to eccentric and isometric exercises. The implications and how it relates back to the current study are that isometric exercises can be used to reduce pain and motor inhibition in the early stages of rehabilitation, to provide an important option for clinicians to offer for those suffering painful tendons. This can also be used in painful tendons that are difficult to load without aggravating symptoms. The second study reviewed by researchers looked into different mechanisms on which eccentric exercise might affect Achilles tendinopathy, which was called Why Are Eccentric Exercises Effective on Achilles Tendinopathy? This article was a clinical commentary on different mechanisms and effects on eccentric exercise on Achilles tendinopathy. This study is important and related back to the study being performed because it found that eccentric exercises are the most effective treatment in the rehabilitation of Achilles tendinopathy, and shows that more research does need to be done on the effects of treatment on Achilles tendinopathy. The study found that eccentric exercises are effective in the rehabilitation of Achilles tendinopathy, and also found that eccentric exercises could possibly change neuromuscular output and thus reduce the load on the Achilles tendon.
That it?
Yeah. The third study, called Reliable Protocol for Shear Wave Elastography of Lower Limb Muscles at Rest and During Passive Stretching, investigated 10 different subjects with no documented muscular pathology: the biceps femoris, gracilis, rectus femoris, sartorius, semimembranosus, semitendinosus, vastus lateralis, vastus medialis, medial and lateral gastrocnemius, and soleus were all measured at rest and in a passively stretched position. The study found that there were significant differences between the muscles when they were at rest and in a stretched position. The study related back because it shows that shear wave elastography is an appropriate tool to evaluate the ability to characterize muscle properties both at rest and during passive stretching.
So the methodology of this study includes the participant characteristics. We had about 30 participants, and they were split into two groups. We had the eccentric group, and we had the eccentric plus isometric group. We had two criteria for this participants as well. The inclusion criteria, including age had to be over or equal to 18. They had to have minimal symptoms that lasted at least 8 weeks, and they had to have the physical ability to perform physiotherapeutic exercises. Their exclusion area, they had to they couldn't be over or underweight, the previous Achilles tendon rupture or foot operation, and any known neuromuscular diseases. So for the eccentric group, we had about 15 subjects, 9 of them being males, 6 of them being females. They had an average age of about 55, and they had an average of about 2.8 hours of sport participation per week. Their average weight was 76.5 kilograms, and their average height was 174 centimeters. They also averaged a body mass index of around 25 kilogram meters squared. For the eccentric and isometric group, we had 15 subjects as well, 10 of them being males and 5 of them being females. The average age of this group was 47, the average sport participation being around 4 hours per week, and the average weight being about 75.5 kilograms. The average height was around 177 centimeters, and their average body mass index was around 25 kilograms per meter squared, just like the eccentric group. So continuing with the methodology of this study, we had dependent variables, which were the muscle stiffness of the medial and lateral gastrocnemius muscles, which were measured using the shear wave elastography. And our independent variables, we had 2. Our first one was the type of exercise intervention presented to the subjects, one of them being eccentric and the other one being eccentric plus the isometric. Our second independent variable included the different measurement pinpoints. First one being at baseline or 0 weeks, second one being after the first follow-up, which was after 4 weeks, and the last one being after the second follow-up, which is the 12 weeks. So the materials of this study, we had ultrasound imaging systems, we had exercise equipment, measurement protocol, software for data analysis, and evaluation tests. So some ultrasound imaging systems that we used in this study was the A-Explore ultrasound system, which produces supersonic imaging. We also had a transducer, which was a high-resolution linear probe used on the gastrocnemius. These ultrasound imaging systems were used for shear wave elastography measurements to assess the stiffness of the medial and lateral gastrocnemius muscles. The equipment we used in this study was just a simple step for performing plantar flexion and dorsiflexion during the eccentric training of the study. And we also used door frames or walls for support during the isometric exercises as well. The measurement protocols that we used was shear wave elastography assessments, which were conducted in a longitudinal plane at 1/3 of the lower leg length from the popliteal crease to the lateral malleolus of the lower leg. The ankle was also positioned into a 30-degree plantar flexion position to minimize the passive tension on the gastrocnemius during measurements. For our data acquisition, the probe was strictly held in a parallel plane to the muscle fibers, controlled by the B mode image to avoid measurement errors due to anisotropy. Software for the data analysis that we used was the SPSS version 22, which used for statistical analysis to identify any significant differences into our calculations of our data. Some evaluation tests that were used in the study were the Kolmogorov-Smirnov test, the Chi-2 test, which is also known as the X-squared test, the ANOVA, post hoc tests, as well as the t-test. So a couple figures from our article. In figure 1, we can see the desired position of the subject, which is in a 30-degree plantar flexion position with the feet off the table. In figure 2 over here, we show the transducer positioning, which was a third of the lower leg length from the popliteal crease to the lateral malleolus of the fibula in the longitudinal plane. So a few more figures included in our study. Figures 3 and 4 represent the eccentric only exercise by putting a foot into maximal dorsiflexion and returning it back to neutral or slight plantar flex position. In figures 5, 6, and 7 over here, we can see the demonstrated isometric and eccentric exercise combination. So this figure shows us an example of a shear wave elastography picture in the lateral gastrocnemius, which was taken in 30 degrees of plantar flexion. So for our first table here presented in the article, it demonstrated the overview of eccentric exercise and the combination of isometric and eccentric exercise. Specifically, they looked at the frequency per day, they looked at the sets and repetitions, looked at how much pain was caused, and the technique and adaptive load levels. Table 2 of this article represented the averages and standard deviations of the characteristics of the subjects presented in each group.
All right, so this table right here demonstrates the baseline of muscular shear wave elastography values compared to the individual differences between the medial gastrocs and the lateral gastrocs, and eccentric versus eccentric plus isometric findings. There was no significant differences for the left or the right asymptomatic or symptomatic limb. All right, so this table right here, table 4, this shows the effects of a 12-week training program with eccentric and eccentric plus isometric training on shear wave elastography. This shows that there is no significant alterations in medial and lateral gastrocnemius of the limbs with asymptomatic tendons over the course of the 12 weeks. And MG stands for medial gastrocs, and ML stands for lateral gastrocs. So here are the main findings of this study. It found that the elastic properties of the gastrocnemius in patients suffering from Achilles tendinopathy do not show any significant signs of alteration in the 12-week training program. For the eccentric exercises, it found that there wasn't any change in the elastic properties of the tendon in symptomatic participants. With the eccentric exercises plus the isometric exercises, it found that there wasn't any change in the elastic properties of the tendon in the sympathetic participants. In the asymptomatic participants, aka the untrained limb of the participants, it found that eccentric exercises did have an effect, and it showed an increased shear wave elastography values. Some of the implications of this study are that the eccentric and isometric exercises on their own may not be enough to alter the elastic properties of the gastrocnemius and symptomatic causes of Achilles tendinopathy. Some of the limitations of this study are that they only use one modality, and they recommend further use of modalities. This study also found relatively small sample size of about 30, and that limits the generalizability of the findings. It also had a range of the severity of Achilles tendinopathy, which could also influence the results. So this is how this study can be used in the application of a student athletic therapist. So firstly, it can optimize recovery and prevent injury. So the results of this study show the importance of recovery-based strategies such as stretching, soft tissue, and cryotherapy for athletes undergoing heavy eccentric training, and this will reduce stiffness and increase in uninjured muscles to avoid injury. Cross-education effects. This helps by training the limbs eccentrically, and we can influence the elasticity in the affected limb. This gives the athletes exercises while injured, and this helps maintain the strength and elasticity of the uninjured limb while having a positive effect on maintaining the strength of the injured limb. This allows for athletic therapists to maintain the strength of the injured limb while rehabbing the injury. So the third one is specialized rehab programs. And this can be specialized by not only focusing solely on eccentric exercise, but also this was previously thought to be the main type of exercise to do while recovering from Achilles tendinopathy. But to include a variety of muscle contraction types during recovery, an athletic therapist can use this information when creating rehab programs for those suffering with the posterior leg injuries of Achilles tendinopathy.
Does anyone have any questions?
I do! So, how did the eccentric and isometric training protocols lead to differences in outcomes between the medial and lateral gastrocnemius muscles? And how might these differences affect rehabilitation strategies for the Achilles tendinopathy?
The study found distinct changes in muscle elasticity between the medial and lateral gastrocnemius muscles, suggesting that these muscles respond differently to eccentric and isometric training. For example, eccentric training may preferentially target the medial gastrocnemius, improving its elasticity more significantly than the lateral gastrocnemius. This finding highlights the need for tailored rehabilitation strategies that consider the unique roles and responses of each muscle head, ensuring comprehensive treatment for Achilles tendinopathy patients.
Does anyone have any other questions?
Me. How do the findings of this study translate into practical recommendations for physical therapists treating Achilles tendinopathy, and are there specific patient populations that might benefit more from one type of training over the other?
So the findings suggest that incorporating both eccentric and isometric exercises can enhance elasticity of the gastrocnemius muscles, reducing mechanical stress on the Achilles tendon. For patients with acute pain, isometric exercises may be prioritized initially to manage symptoms without excessive strain. In contrast, eccentric exercises could be emphasized in the later stages of rehabilitation to promote tendon remodeling and functional recovery. Athletes or individuals with high physical demands might benefit more from eccentric exercises, while those with more severe pain or limited mobility may start with isometric protocols before progressing.
That'll be it for our presentation.
Thanks everyone for watching.
Hope you enjoyed it. Have a good one.